Thank you for taking the time to watch this brief introduction to the new response kits that have or will be placed in each classroom in Putnam County. This project has been made available by CAMC-TV Hospital. This video will serve as a brief introduction to the bag itself and its contents. Additional videos and/or training will be made available to you in the near future. We wish that this is something that we didn't have to address. However, sadly, several emergencies, both small and large, are happening in schools across America. Of course, we hope that you will never have to use this bag, but in the situation you would, we want you to be as prepared as possible. Please remember this bag is only to be used in true emergencies and will not diminish the need to call 911 for appropriate resources. Reality is that if you're using this bag, something major has gone wrong. It is our hope that you will be able to effectively keep your students safe and be able to treat any life-threatening injuries until help can arrive. When we think about emergency situations at schools, the first thing that normally comes to mind is an active shooter. This, of course, is a possibility, but there are other types of situations when this bag could be utilized. Structural collapse, bomb detonations, and natural disasters, to name a few. This bag is designed to be used in life-threatening situations where, for whatever reasons, you will need to provide care for a student or fellow faculty during an emergency until more trained personnel take over. Each classroom in Putnam County will be assigned a response bag that will look like this. Now we'll take a few moments to go through the contents of each bag. After you open the bag, you will be able to see all of its contents. Each kit is laid out the same and will contain the same supplies. Please take a few moments to view the different compartments within the bag. This slide contains the tools which have been made available in each bag. In the top left corner, there's a blood pressure cuff which can be used, along with a stethoscope, at the bottom of the screen to take someone's blood pressure, if you're familiar with how to do so. Beside the blood pressure cuff is a set of shears or scissors which can be used to cut away clothing or to cut bandages and dressings if needed. Next to the shears is a pen light which can be used as a flashlight or to check someone's pupils for reactiveness if you're familiar with how to do so. Next are tweezers, followed by forceps, which function as a clamp. This slide shows PVP prep pads and alcohol prep wipes. Both are used to clean skin prior to starting an IV. Alcohol preps can also be used to do initial cleanup of blood. Non-pictured are non-latex exam gloves, which should be worn when you are utilizing this bag. This slide shows the different wound care options within the bag. To the far left is a trauma dressing, which is used to cover large cuts. In the top right corner, there are 4x4s, which are used for smaller cuts. Below the 4x4, there's an ABD pad, which can be used for smaller cuts that are bleeding a lot, but are too small for the trauma dressing. To the left of the ABD pad, there's an eye pad, which can be used for an eye injury. In the middle of the slide, there are different sizes of gauze and cling, which can be used to hold the trauma dressing, 4x4s, or ABD pads in place. The bottom of the slide shows tape, which can be used to secure gauze and cling, and can be used for other purposes as well. Lastly, there are some band-aids provided for minor cuts. The green stick to the left of the slide is called a bite stick. The next item is a pocket mask, which can be used to deliver breaths to someone who is not able to adequately breathe for themselves. The mask must first be popped into position. The pointed end would then go over the patient's nose, and you would make sure you push down on the mask to ensure that air goes into the patient's mouth and would not leak around the mask. More specific instructions can be provided on this piece of equipment. This slide shows some splinting options which are available in the bag. In the top left is a SAM splint. This can be rolled out and formed to either an arm, elbow, or portion of the leg and will provide some stability to the injured limb. This can be secured to the patient's limb with using either gauze or cling, shown in the previous slide, or using the ACE bandage pictured here. The ACE bandage can also be used for wrapping an injured ankle or wrist. Lastly, to the far right is a triangular bandage which can be used to make a sling for an injured arm or shoulder, or could also be used as a tourniquet in the situation that there is significant bleeding. In the top left of the screen, there's a cold pack which can be placed on an injury site to help with pain and swelling. Below the ice pack is an eye wash, which can be used in an eye emergency to rinse particles or powders out of the eye. To the top right is an emergency blanket which can be used to cover a patient who is cold or has lost a lot of blood. The next two items are bee sting and snake bite kits. This is a burn sheet which can be placed over a patient who has a large burn to their body. We realize this is a lot of equipment and information, both of which you may not be familiar with. However, this video is not intended to teach or train you how to use this equipment, but to make you familiar with it. Separate videos will be provided to demonstrate the use of several of these items.